Hi, this is Brian Kim. I'm going to share with you this case of a dense white cataract, and you're going to see trypan blue as well as double chop, cross chop, mechanical fracturing techniques, and how I systematically disassemble this lens, minimizing ultrasonic energy, utilizing mechanical fracturing. Again, I'm chopping the lens, breaking it up into small pieces without using any vacuum or ultrasonic energy. In my opinion, this is very safe, very systematic, and a very controlled way to disassemble the lens. So I'm using a corneal marker, which will help me to center and size my rhexis, make a paracentesis incision on the right side and then the left side. The incision is made parallel to the iris plane, which will create a corneal shelf, which will enable me to make a self-sealing corneal incision. I'm injecting some intracameral lidocaine, and then using the same cannula, I'm going to inject some intracameral air, and then I'm injecting some intracameral trypan blue, painting the anterior capsule surface with a cannula. I'm injecting dispersive viscoelastic to fill the anterior chamber and flatten the anterior capsule. This is the bi-beveled corneal incision with the metal blade. I'm placing the tip of the blade just near the limbus, puncturing, tunneling through the cornea, and when I get to that mark, I use a cannula to turn the eye towards me, and then I enter. I'm using a puncture style technique for the capsular rhexis. This is not an intumescent lens, so I felt confident I could do a puncture technique. So I punctured and then grabbed the right side of the tear, and I'm going around circumferentially, grabbing and re-grabbing, using the corneal mark to help me center the rhexis. So after I'm done with the rhexis, I burp some viscoelastic. This is a capsular fornix hydrodissection technique. I place the cannula out underneath the rhexis edge contra-incisionally. As I inject, the bag fills up, I decompress it, and then I turn the cannula to the right side, tip down, and the lens begins to spin. You can see there's minimal cortical material as I spin the lens. I irrigate the surface of the cornea, lift the incision with the chopper, go in with irrigation off to minimize decimatous trauma. I remove the surface epinuclear material, place the chopper underneath the rhexis edge out to the equator, point the tip vertically subincisionally, crushing the lens in half. That's double chop. Place the chopper around the right heminucleus, pulling it centrally, crushing it and dividing it. That's cross chop. You can see there are some leathery adhesions, so I'm trying to separate the lens pieces. I use a little bit of vacuum to hold that first quadrant, lifting it up a little bit, placing the chopper around the lens piece, crushing it between the chopper and the phaco tip, and then emulsifying the lens pieces. Use a little vacuum to grab that other fragment there, lifting it up and then emulsifying the lens piece. Placing the chopper around the second quadrant, lifting that piece up and emulsifying the lens pieces. That piece was still adherent to the lens, so I just go ahead and turn the entire second heminucleus in front of me, placing the chopper around the lens piece, dividing it in half, placing the chopper around the third quadrant, pulling it centrally toward the phaco tip, and then dividing that lens as well. Using a little vacuum to position the piece, and then crushing it between the chopper and the fingertip, using successive crushing forces to break down the lens into smaller pieces, and then emulsifying the lens piece. This is a chalky, dense lens. It's not really that leathery, but when I'm chopping it, I can feel the density of the lens as I'm crushing it into smaller pieces. So I'm turning the lens in front of me again. That's the remaining part of that third quadrant. Place the chopper around the lens piece, crushing it between the chopper and the fingertip, dividing it very carefully. Again, when I'm doing that move, I'm not using any vacuum, and so it's a very safe maneuver, very controlled, very systematic. Once the lens is smaller in size, I'm able to mash it and crush it into smaller pieces and then emulsify the lens pieces. I'm placing that fourth quadrant in front of me, placing the chopper around the lens piece, crushing it and dividing it in half, placing the chopper around that fragment again. That lens piece shifted and it was a little bit awkward to get to it. So I took the chopper out and I'm injecting some more viscoelastic to coat the cornea, but also to position that lens piece in a little bit of an easier position for me. Place the chopper very carefully around the lens piece, pulling it centrally toward the fingertip, dividing that lens piece in half, making sure I'm separating every bit of it. And again, I'm doing this purely under irrigation, so it's a very controlled maneuver. Again, crushing and dividing these lens pieces into smaller and smaller pieces, and then emulsifying the lens pieces. That lens piece keeps trying to go to the right, so I'm hooking it back, bringing it centrally, crushing it between the chopper and the fingertip, and then emulsifying the lens piece. So this is the last piece. You can see it's a free-floating piece. There's very little cortex. There's very little that's protecting me from the posterior capsule. And so that's why using mechanical fracturing forces, which again is under irrigation only, there's no vacuum, there's no ultrasonic energy. Just with the lens pieces floating, I'm able to use both instruments to chop the lens pieces into smaller pieces. And so that's really the crux of the maneuver, is you're able to perform chopping techniques. Even though the bag is completely vulnerable, I'm able to chop the lens pieces very confidently because I'm doing it only under irrigation. I take the chopper out, push BSS in. Actually, before I go in, I saw a small fragment there. So I go ahead and stop, and I'm making sure I'm pushing BSS, making sure irrigation is activated, and then I emulsify that tiny little piece. Took the phaco tip out and then went in with the INA handpiece, and I'm adjusting the sleeve to make sure it's close to the tip. I start sub-incisionally grasping the anterior cortical material, sweeping side to side. So under Cortex mode, I'm making sure I'm sweeping, getting any cortex that might be hidden. There's just some small fragments of cortex still there. Polishing underneath the rhexis edge as well. So then I switch to the polish mode and I start polishing the posterior capsule. And then I'm polishing underneath the rhexis edge as well. And I'm pushing BSS through the paracentesis into the subincisional capsular fornix and I'm pulsing BSS to remove any potential lens material that's stuck underneath there. I saw a few little remnants coming out. Now I'm injecting some cohesive viscoelastic to fill the bag. I had to flip the sweeper. She gave it to me upside down, so I had to flip it over. I'm sweeping on the left side and then on the right side. This is a three-piece lens in very dense lenses, white lenses. I am afraid of weak zonules, and so I like to put three-piece lenses in these situations. In case there's late dislocation, I can lasso the haptics to the sclera. So I'm widening the incision for this three-piece lens injector. Once it goes in, I turn the bevel to the left, so the leading haptic comes out planar, pointing to the left. Place it into the capsular bag. As the optic is delivered, I rotate the barrel 90 degrees counterclockwise, which allows the optic to come out correctly. And then this is the Maltzman, and I'm going to dial in the trailing haptic into the bag. So go ahead and activate irrigation once I'm in the eye, and then I go under the lens, removing all the viscoelastic from within the bag and underneath the lens. Reposit the lens back into the bag, polishing underneath the rhexis edge once again. You saw that the screen changed. That's because I'm advancing with my own foot pedal, and I'm still trying to figure out how to do that without making any jumps too far forward or backward. And so I switch to visco mode, remove all the viscoelastic from the anterior chamber, and then I hydrate my incision. You can see there's a little bit of a posterior capsule fibrosis in this dense lens as well. Again, this is a white dense lens. I injected trypan blue to paint the anterior capsule surface. You saw double chop, cross chop mechanical fracturing techniques. And again, you saw that when the lens was pretty much all gone and there was just a small piece left, I was able to break down that lens without having to use vacuum to hold the lens piece by sandwiching the lens piece between the chopper and the phaco tip. That's why it's called double chop, being able to crush the lens piece between the chopper and the phaco tip. This is a very controlled and systematic way to disassemble the lens. So I hope this was helpful to you, and I thank you for your attention.